The vision and the mission of Texas Children's Hospital, it's very straightforward. It's quality and excellence in 4 areas: patient care, education, research, and charity care. Texas Children's will today treat about 7,500 children.
Patient care is job one. We have to provide the highest quality patient care to every child, every infant that we see. But beyond that, we want to drive innovation in pediatric health care. You can't have great programs in pediatrics without working side by side with great surgeons.
Any surgical issue that a child might face, we would have the ability to treat it at the highest level. We're a level 1 trauma center. We never consider any operation in a child a trivial matter. It's all a big deal.
We're no longer a children's hospital. We are a children's and adult system. We deliver comprehensive women's care from preconception to menopause and beyond.
Well, without quality education and ongoing and continuing, then outstanding quality patient care begins to wither on the vine.
The future of medicine is embodied in education.
One of the pillars of our mission is to educate tomorrow's leaders, and we take that very seriously.
We're proud, very proud of our educational programs. We believe that we're recruiting some of the best and brightest young physicians in the world who literally could be training in any program in pediatrics in the United States, and they have elected to come and train with us right here.
As you're thinking about residency training, you want to go to a place that's going to make you good at the end of the years.
Vasculitis.
And I don't think that's truer any place in the country than Texas Children's.
Education, by the way, extends beyond the doctors and the nurses and the respiratory therapists and the social workers, because we have an obligation also to educate our community, the families that we work with, the children themselves. Everyone is a part of the process.
We have a responsibility to push the boundaries of science and to advance the medical field.
When you talk about pediatric research in the state of Texas, you really are talking about Texas Children's Hospital and Baylor College of Medicine. This year we have more than $100 million in funded research.
We're not here just to practice state-of-the-art medicine for today. We're here to come up with new medical breakthroughs for tomorrow and to accelerate research in basic sciences and to translate that research into better care at the bedside.
We had to go up overnight.
What we learn in the laboratory and through the translational research that we do makes its way to the care of patients that we see every day.
And so it's not just the here and now at Texas Children's Hospital, it's what are we going to be doing in 2020 and 2030 and then beyond. We get excited about this work. We get as excited about charity care as much as we do about some of the state-of-the-art research that we carry out here at Texas Children's Hospital.
Over $100 million in charity care each year.
No child or mother goes without necessary care because they do not have the resources.
We don't turn anybody away for inability to pay.
That's a solemn obligation.
And that permeates the institution. Never do you hear a dialogue at any level about patients' finances. People just are going to do what they need to do to take care of the child.
And we not only accept them as they come into our emergency department, but we run toward opportunities of finding those children that are disengaged and not a part of the system. And we've done that through Project Medical Home.
I love it here. I wouldn't take them anywhere else.
And it's amazing. The more charity care we provide, the better we seem to do financially and every other way. So we're going to continue to accelerate and push on how much charity care we provide until someday every single child that lives in Houston, Texas can access a pediatrician, a pediatric specialist, a clinic, or even Texas Children's Hospital whenever they need to.
Beyond that, we of course have infrastructure and human capacity on the ground across Africa and in Eastern Europe, serving some of the world's least fortunate children. So our reach and the impact we have for children is truly enormous.
Taking care of all children regardless of their ability to pay, every single day at Texas Children's Hospital.